with our board member. Welcome, Dr. Deng. Before that, I do want to thank you all our speakers and our sponsors. And without their support, we're not going to have a successful meeting. Thank you.
Thank you, Dr. Lee, and welcome. And first, I want to introduce our first speaker, Dr. George Kang. And Dr. Kang is attending the Department of Surgery, Division of Surgery, Surgical Critical Care, and Acute Care Surgery Division. I don't know what's the difference between acute and critical. And he has been served as the surgical department resident program director for 7 years at Rochester College, Medical College. And he has a lot of experience on review the rest candidates, train them, and he probably will give us a lot of valid suggestions how to apply the resident, how to survive during the resident program. And his talk today is surgery resident application and the strategy. Welcome, Dr. Kang.
Thank you. Good morning, everybody, and it's very nice to be back here. I'm at the same hospital as at Westchester, and I'll start with saying that I'm also a foreign medical graduate, right? So when I went through the process in our residency, also has foreign graduates, and I'm here also, on behalf of the Chinese American Medical Society camps. So most people will ask, what's needed? What are the main things in an application when you're applying for residency? How do I advance? Was it the arrows? Oh, okay, it's working. Yeah. So there's a little bit of a lag.
It's on my computer.
Oh, it's in your computer.
Yeah. We can switch out.
That's okay.
Actually, do you want that?
Is that the mouse? Thanks. So there was a survey that was published, and for those of you who want to get into surgery and want to look at the actual data, you can look it up. There's a survey in 2020 that asked all the program directors, what are the main factors of getting into residency. And here are the results. At that time, you have to bear in mind that USMLE still had a score. So obviously, that's the main thing. If you have taken the USMLE and you have a score and you have a good score, it's an advantage because most everybody nowadays will have a pass or fail. Letter of recommendations will be important. USMLE step 2. Every specialty is a little different, and it's based on data, right? So people do research and then they see for the people who graduate in general surgery and to pass the boards, they'll try to make an association. Does it associate better with passing the step 1 or the step 2 in surgery? In surgery, it was step 1. Other specialties, it may be step 2. We don't know. So it's important to know, why every specialty gives such an importance to one over the other. So in surgery, it's step 1, more important than step 2. But then now that has changed because step 1 is pass or fail. Then personal statement, clerkships, grades, professionalism and ethics, leadership qualities, et cetera, right? So you can see the factors in here, and more importantly, you can look up the report, the publication, and look for yourselves. These are the main factors to get ranked. So there are different steps in the process of getting into residency. as a foreign medical graduate. The first one is to get an invitation for the interview. And once you get an interview, then this becomes, more important. So the things change a little bit, right? Now you can see that step one gets you the interview, but it's not the most important factor in here. So once you get the invitation, the interaction with the faculty, how they perceive you as a candidate is a lot more important. And I would say that, when you, as a foreign graduate, if you keep things in perspective, at Westchester, we had like 1,000 applications for 4 positions. In surgery, sometimes, we go to conferences and then they compare it to, people trying to become an astronaut, right? You start with a very big pool. Only a few people will make it through the training, and then very few people will actually, fly on the space shuttle. So I mean, they always compare it a little bit like that because of the numbers, and I think that's that's fair in a way. So these are the factors to get ranked, and so people, once you get interviewed, people can probably tell, just from reviewing everything, how competitive of a candidate you are. But congratulations if you made it this far. The interest in the program is important. The interpersonal skills, everything in the that was that they can see in the interview will be important. So let's talk about all these things sort of a little bit more detail. For surgery, these are sort of the scores for surgery. Essentially, there's a cutoff. Often in surgery, there used to be a cutoff of about 230. Now that is pass or fail, they're probably going to use step 2 just to get an interview. But nowadays, people are moving more towards a holistic review of the application, which means that people are going to try to read, all the applicants. I think this applies more for the U.S. graduates because there's just a logistic problem for the international graduates. We have 600-700 applications for 4 positions. How many faculty do you need to have, for us at Westchester to be able to review 3 letters of recommendation for each one, et cetera, right? So when you hear about the holistic review, somehow, this may or may not apply for U.S. medical graduates, depending on how each program decides to go about this large number of applicants. And here's where you have to think about, how do you stand out, amongst all these applicants? Is it because of your U.S. and Middle East scores? Well, none of it's pass or fail. You're going to be able to big pool of people who passed it, hopefully, right? Maybe the step 2, or maybe something else, and that's what you have to think about. It may be research. For U.S. graduates, these are the scores. About 230, would be an average to for the applicants. The majority of the people, the bigger the dots, the more people in that category. So most of the people, will be, above 230. If you're below, it's going to be hard. For foreign graduates, more of the, obviously people will have a higher higher grade, and then it's important to see, like, above 250, there's a good number of people with near perfect scores. You're competing against all these candidates. Letters of recommendation. This is important because a lot of times the faculty know each other, right? If you're graduating from a program in New York, there's a good chance that we will know the colleagues who wrote the letter. If you are a foreign medical graduate, the chances are less that people will know who wrote the letter for you. And for general surgery, it's important that the writers are surgeons. There's a reason it probably applies for different specialties, but one of the main reasons is commitment to the specialty, right? If you ask, another physician from another specialty, they may know you very well, but the issue is, in the interviewers or in the program's mind is, do you really want to do surgery, or is surgery your backup? Maybe you want to do orthopedics, or you wanted to do neurology, and your closest mentors or faculty happen to be from that specialty, right? I mean, that crosses people's mind every time you have a letter writer who's not from your specialty. So bear that in mind. A lot of times when you're from another country, then you have to think about and help your letter writer, put the important things in the letter. So just to go over, a few tips of how I tend to write the letters when I write them. I often give them a short introduction of who I am, so that the reader knows who the person is and what the relationship they had with you. When I do that for the residents, it's very easy. I've known the residents for 5 years. We presented, at different meetings, and so that's easy to tell. I also give a little bit of background of who I am, right? So I'll say, I was a program director, and we have graduated like 30 surgeons in my tenure. I've been involved in the, education of a good number of residents and medical students, and et cetera. And then with that background, then I'll say, well, the person I'm writing a letter for, he's hopefully the best in this year, best in 5 years, et cetera, right? Or the best, trainee I've been with. They say that there are some keywords in the letter of recommendation when we have a medical student and say that we're actively recruiting to our program. It may or may not be true, but there's usually a positive way to say it. If your letter writer can put things into perspective, right, give you a class rank. Sometimes the U.S. schools don't give a class rank, many of them. But if you can say, best students in a class of 120, it gives the reader that perspective. I mean, you are really at the top of your class, right? So on and so forth. So it's important that your letter writer can put as much substance as they can. They show they actually know who you are. You work together. Sometimes it's just the descriptive letters can not be so helpful, right? Because most letters from everybody will be good, but if you know how to put a few of these things, it can be helpful. So I did mention that most letters people will expect from a surgeon, or from you spend some time doing research with somebody maybe not in the specialty you're going into. You probably want to include that person's letter nonetheless, right? You're a research fellow, for 2 years with so many publications. You want to have that person write a letter for you, because at the end of the day, people will look at your CV, see what you did, and they want to be able to create this picture, and that's a very important picture, even though it may not be the ultimate specialty where you want to go into. But you happen to spend a couple of years doing research, with that person. They should be able to attest to your work ethic, your qualities, your ability to communicate, et cetera, et cetera. And those things are not measured, obviously, in the board scores. We have lost. Maybe we're too far. Or just advance the slide for me, if you will. Thank you. Yeah. The next thing is the MSPE. For those of you who don't know, it's a medical student performance evaluation. So this is a document that the U.S. medical schools create. It's a little bit of a standard format, even though every school is different. And as far as I know, most foreign medical schools don't have it. So it feels a little bit like a letter of recommendation from the school, and a lot of times you have to create it and translate it. You have to, as a foreign graduate. It's a bit of a narrative of your experiences. Like a narrative of your transcript of your grades, right? Often it goes into remediation, probation, gaps, explains special circumstances, and sometimes it'll give the class rank in here, as opposed to the transcript that gives the grade. As a foreign medical graduate, sometimes you just have to help your school create it, and then just have an idea what it is. Personal statements. It's important to know that every interviewer or every program, they look at different things. My chair used to look at a personal statement very closely, and then a lot of times the conversation with the trainee was about the personal statement. Other people would look at the letter recommendation because they knew pretty much a lot of the faculty here in New York, not over our candidates were from your schools in the area, so they knew who wrote the letter personally, and then they would look at other people will look at the board scores or big picture. That's probably sort of my style. What to put in here? I would say certainly avoid controversial topics. If you have compelling story that explains why you want to go into a particular field, sometimes people then use that, right? In my field, a lot of times they have surgery or they have some sort of accident, spend some time in the hospital. I'm a trauma surgeon. That's the population that I see. Sometimes it connects with a reader, but most people don't have that, right? And if you don't, then you have to try to explain why you want to go into the field, and that's the purpose of the personal statement. If you're a foreign graduate, then sometimes it's a good window to explain, how is it different in where you trained, or those things are not evident for the reader. But at the end of the day, you have to craft it. It has to be well written. Explain it. Make the point that you want to make, why you want to do surgery. If English is not your first language, then make sure that it's that you check the grammar. Sometimes they're professional reviewers. Now write it yourself. The worst thing that people want to do is nowadays with AI and ChatGPT, if you write something that you cannot that the interviewer, when they talk to you, that they can tell that, hey, it wasn't you who wrote that, right? And then it's going to raise some flags. So be genuine about the story. Make sure it's well written, and try to avoid some controversial topics. Your CV, I think this is pretty important. It tells you what you have done for the match. That's a standardized format. You put in there, if you have any national meetings, attended, your experiences, etc. I would say that in here is where most foreign graduates, if you want to stand out, it's probably going to be with your publications, right? The number matters, the quality matters a lot, but put it into perspective. If you're applying to be a resident, they don't expect your research, you to be an expert in the field or anything like that. But if you can stand out from your peers with having a couple of publications, I think that'll make a difference. And I would say, in our personal experience, so the medical graduates the foreign medical graduates that we take have taken at Westchester, and we have taken, roughly one categorical residence out of 4 every year. It's because they have stood out with their research experience, and then you bring something else to the program when you have 20 publications in the U.S., and you have gone to the national meetings and that. So there's a take-home message from my talk to foreign graduates aspiring to get into residency in the United States is to consider this, right? Consider buffing your CV, because there's a good number of people with near perfect scores applying. By doing research, spending the time doing that, attending national meetings in the United States, and presenting them, because that, as a foreign graduate, that gives you the experience of how medicine, academic medicine, is in the United States, and it gives you a little bit of a head start too once you get accepted at a program. The interview is very important. You usually don't want to stand out because of how you dress. You want to stand out because of who you are and how you conduct yourself. So for most everybody, wear something black. Most of the times people wear black. If you wear something with a little bit of a bluish color, you may stand out as the only person. So let me just play it safe. And you already stand out sometimes as a foreign medical graduate. You don't want to stand out anymore. You want to be considered, once you're granted the interview, especially if they're in person, like everybody else, right? So I mentioned this a little bit. Every interviewer is a little different. There's the letter of recommendation reader. I called one of them, some of my former colleagues. My chair used to look at personal statements and research, and then just talk about those two things. Everything else, he assumes, like everybody else, will probably have gotten a grasp on. And this is usually a committee, right? There are a couple of faculty interviewing you. A few people have reviewed your entire package, and then a judgment is made about where you fit into the rank order list. I often ask people, tell me where you see yourself in 10 years. It could be an idea of what people are seeking, and whether we're a good match culturally for what they want to do. And if you can, a brief follow-up thank you email is probably okay. The most of the sort of surgical education societies are recommending against spending a lot of paper and postage just from a ecological standpoint, but I think a brief email is okay. Also, be aware of the informal interview, either via Zoom or in person, right? Like the dinner before, where sometimes you just meet with the residents, is just as important. So every single program were asked, the current residents were hosting the dinner for the candidates for feedback. Like, did this person, engage with the group? Would they fit in okay in the culture? That's going to be important. And if it's a Zoom interview, then that waiting area, are they behaving professionally? Are they do they stand out negatively, in the crowd? Because it may be somebody who stands out, when they join your program in a way that you want, or maybe you don't want, right? So all that is important. Also, your interactions with the coordinator, with the people who are coordinating your interviews, and they're not faculty, but they also give some feedback and make sure you have your sort of put on your best face. Sometimes these matter even more. There's another informal interview that's important in here, especially for foreign graduates. If you are working, on a project, right, and you get to present at a national meeting, in the field, in surgery, for example, and then a lot of people see you present, in front of the audience, and then you got to shake hands with a couple of your faculty, of your mentors, colleagues, because you usually follow your faculty around. That's an interview. That's where they got to know you outside of the interview process, right? Those are the interviews where you usually do very well. The people are going to remember what you did. So remember, those are the avenues, the windows that open, open it up for you to get into residency, which can be competitive, right? So those are the informal interviews that sometimes matter more than the real interview. Can you advance the slide for me, please? It's not working. It's maybe too far, but it's. So the research years, this is sort of what I had alluded to. There are lots of foreign medical graduates, like we could see in the initial slides, with pretty much perfect USMLE scores. Then there are positions available, so you have to try to stand out with something. Our residents, it's a unique group, and for the foreign graduates, they have had up to 2 to 7 years of research many times. It's a significant commitment, but it also gives you that opportunity to be in academic medicine in this country, if that's what you want to do. Some people have an advanced degree, but I would say that for somebody in surgery, it's more important if you to show that you have been able to publish than to just have a degree. At some point, we don't need any more degrees. You already had an MD degree if you're applying. Sometimes the degrees are, open other doors for basic science, research, etc. Those, obviously are different. But I would say that it's important to be able to publish when we look at the candidates. There's some preliminary years in surgery. They typically don't fill. There's a long story of why there are other specialties that in the past had to do a year of surgery and etc. So most of those positions are first year preliminary positions. So they will be filled with people wanting to go into radiology or anesthesiology, where they'd have to do a year. Some of them will be filled with people who want to get into surgery, but somehow we didn't rank them high enough to match into a categorical resident. Many foreign medical graduates will enter general surgery in this pathway. The second year preliminary positions exist also. And sometimes they'll give it to the person who wants to get into surgery and hasn't been able to get into it yet. It's important to pause in here because if you do a first year, if you were fortunate enough to match into a preliminary position, congratulations, you made it into the system. There's a good chance that you'll land for a position if you work hard. In what we don't know. Sometimes there's a spectrum of specialties. Sometimes we'll suggest if we think that the resident will have a tough time getting into a categorical position, we'll try to tell them that and then say now that you have 1 year of U.S. residency experience, you come across sometimes as a different candidate and considers applying to another specialty, maybe a little less competitive. So that's always an option. If you decide to stay for the second year, sometimes it shows a little bit of commitment to surgery. Then the people in other specialties may say, well, maybe do you really want to come into our specialty or not? So it's a little bit of a slippery rope on whether to do that. So that's only after you become a preliminary resident. The categorical residents often that you would be looking for if you're a preliminary would be in the PGY3. There are no preliminary PGY3s, and they do exist. People leave on research. Sometimes people change specialties. That's what you would be trying to compete for. Advance, please. Foreign medical graduates often ask about observerships in the United States. It helps to get a letter from them, but just bear in mind those observerships, people will have known you for maybe a month. I don't know how long you will spend doing the observership. So So that's helpful. I did observerships. I graduated from Costa Rica. I did a few observerships where they wrote a letter for me, and that's how I came in. Our school had a medical exchange program with like several programs in the United States, and that's how we're able to do that. And some foreign medical graduates are already trained, right? You're already a surgeon in another country, and there's different options for you. You can pursue a fellowship first. Sometimes transplant or critical care, they're able to take you without having done general surgery. But that doesn't allow you to work in the United States. You still have to do the residency, and then you have to think about, how do you fit all this into your visa? You're on a visa, the J1 typically gives a 7-year maximum, but if you're in a training program, it extends a little bit. They typically will be, there's a pathway where you can extend that. So that's a thing to consider when you're doing research, and if it's taking some of your clinical years, you'll be doing the residency again. And these people, who are willing to put this amount of time, in my experience, they usually bring something else to the program, and they're welcome. When you're applying, just know that not every program will have the foreign medical graduates programs. Leadership changes, etc. So we'll talk about our program. Dr. Go, and I work at Westchester. It's a flagship hospital for New York Medical College. We're level 1. That's what I do in the trauma department. So this is 800 applicants for 4 spots. We interview about 100. The foreign graduates often have a recommendation from somebody else. We have 4 positions. 2 of them include research. So there's some preliminary positions some of them are filled by people going to other specialties. And out of those are the applicants, and out of our program, about 1 out of 4 is a foreign medical graduate. And, they typically have a perfect USMLE score, lots of publications, and have that experience. So this is just, our experience with foreign graduates. And thank you very much. I'm happy to answer any questions.
Thank you very much, Dr. Kang. It's very extensively covered almost every aspect for the resident program application. I believe who you are or planning to apply the resident program learn a lot. And probably you also have a lot of questions because time limits. We will leave the question and answer to our panel discussion. We introduce our second speaker, Dr. Zimei Zhou. And Dr. Zhou has a lot of similar experience with most of us. Earned her MD in China, Shanghai Medical University, now called Fudan University, and finished her PhD training at Wayne State University, and finished her ophthalmology resident training here, Albert Einstein University. Right now, she's the resident program director of ophthalmology and the retinal disease service director. And welcome, Dr. Zhou. She's going to share her experience on ophthalmology resident in the U.S.